If you get a really bad burn, a doctor will scrape off all of the dead, damaged skin. Then they will cut off a piece of healthy skin from another part of your body.
They mix this up a little bit. This video shows like a full thickness skin removal of the lower back. That's not how it's done. Actually, that thing when you scrape off is actually dermatome, which helps you get partial thickness of the skin graft. So then that partial thickness skin graft is placed over the burnt skin that's removed and stitched in. So this video doesn't explain how the donor site is closed. And so that's my explanation. Partial thickness graft, the skin grows in from deeper areas.
If you get a blister, most people assume you're supposed to pop them. But should you actually do this?
In general, if a blister is less than 1 centimeter, you could leave it alone. But one's greater or close to a centimeter, you do want to pop them with something sterile, but leave that popped skin on there. It acts as like a biological dressing or band-aid for it to heal.
Inside the bubble, there is a small pocket of clear fluid that builds up. This fluid actually protects and heals the skin underneath, acting as a barrier to keep it clean. But when you pop a blister, it exposes the skin prematurely before it has time to properly heal, which is why you shouldn't pop them.
So I disagree with that part because that fluid inhibits it to heal well sometimes with large blisters.
If you break a finger, it can be gently moved back to its normal position. Then a piece of metal is placed along the bottom to support it.
Usually injections like lidocaine where you numb the whole finger so that it can be pulled into place. And then x-rays are taken before and afterwards to make sure the alignment's right.
This splint is wrapped with straps to hold it firmly in place, preventing you from accidentally moving it and causing more harm. And this allows the bones and tissue to have time to fix themselves. Weeks later, the splint comes off, and hopefully you can start moving it again.
When the bones are that far apart, that needs surgery. And those tubes on the sides are usually nerves. If those are broken, they're not going to come back. You're going to be numbing your finger. You need surgery for that.
Stretch marks happen when the skin stretches or shrinks quickly, like during pregnancy or rapid weight gain. This sudden change causes the collagen and elastin in the skin to break, which results in small tears. As these tears heal, they form scars, what we see as stretch marks.
Unfortunately, there are no cures for stretch marks. There's no creams or lotions or lasers that work. If they do, they work very minimally. They will never take the stretch marks away. The only way stretch marks are sometimes rid of if they're in certain places where you can excise them, sometimes a tummy tuck. But stretch marks on the thighs, arm, legs, there's really, unfortunately, no cure for that.